This is a community analysis presentation of Valrico, Florida, presented by Becky Allen, Alan Brian Colquitt, and Amber Patty. In this analysis, we will present a historical overview of Valrico, Florida, a community analysis in regards to the community's structure, population, health-related resources, environment, government and public health, then a prioritized selection of 6 overall community needs and/or problems as perceived from the vantage point of the community nurse's assessment. Being an unincorporated area located in east central Hillsborough County, Florida, and neighbors to surrounding Brandon, Fishhawk, Seffner, and Dover communities, Valrico got its start in the late 1890s when a Professor William G. Towsey from Tufts University, Boston, along with other New Englanders, purchased large acreages of land for development of his new community. The newly settled area was originally named Long Pond for the unusual shaped lake in the northern area of this region. Long Pond was to eventually be renamed Valrico, which thus translate to Valley of God in Spanish by Towsey and his northern neighbors. By 1893, Valrico had over 100 residents, and in 1896 the very first public school was built. Soon to follow were a general store, a few miscellaneous shops, and a local bank. Most commerce at the time was centralized around agriculture and farming. This sustained the new residents of the community and was further expanded by the recent arrival of both peninsular and Florida railroads. This ensured easy access to local travel, as well as the import and export of goods, crops, and animals to and from the region. In 1897, Valrico was unfortunate enough to be hit by a rare Florida freeze. This stalled community development at the time due to the community's primary reliance on the good weather for crops and domestic farm animal production. Population explosions were seen twice in Valrico's history, with the improving of then-known Hopewell Road in 1910, which eventually was renamed State Road 60, and once again in the 1950s when State Road 60 was connected to Adamo Drive. Originally, Valrico was inundated with few subdivisions, primarily ranch-style homes built in the 1950s, and with migrant worker communities sporadically spread over the 14.2 miles of its boundaries. With the development of State Road 60, homes were originally built in close-knit areas along this road, and at the time apartment complexes were few and far between. As the epicenter expands from the center of Valrico, homes were often larger in size. Because agriculture was a dominant commodity to the region, Valrico originally had many trailer park communities that housed entire families of low-income migrant workers. These low-income housing areas were often located within walking distances to local farms, so migrants could easily travel to and from the fields they worked. Most of the trailer communities were owned by the farmers themselves and subleased to the migrants seasonally, only to be rotated with new families as migrant workers traveled from location to location. Before the housing boom in Florida in the early 2000s, these communities were numerous. During the boom, land became very valuable very quickly, and unfortunately many of these communities were sold to land developers. This quickly pushed low-income families to other trailer park communities outside the Valrico area, where now farmers bused the workers to the fields. Although with the result of bringing property values up in Valrico, this is seen by many in community nursing as a severe detriment to low-income families, often leaving them with minimal access to stores, transportation, or other much-needed services that the Valrico community provides. What Valrico lacks in terms of low-income housing, it makes up for in its community built around faith and its outdoor recreational facilities. In the 33594 zip code, no less than 28 various places of worship are found. Many of these religious institutions are also heavily motivated in community outreach programs for not only local but national levels. Many of these worship centers, such as Grace Christian and Nativity Catholic churches, are also fully accredited schools that provide even greater local community service by not only outreach programs, but education intertwined with religious faith support to help grow local children. Being a somewhat rural area of Hillsborough County, Valrico is also rich in its resources of outdoor community parks and recreation centers. Not yet confined by overdevelopment and urbanization of the community, these large parks provide free recreational amenities to local residents and families to allow strong connections to the outdoors.
The largest proportion of the population in Valrico are from ages newborn to 17 years. This causes an increased need of childcare and schools in the Valrico community. There are 9 schools in Valrico. The average ratio of teachers to students in Valrico is 18 to 1, which is higher than the national average of 16 to 1. The second largest population is the working class, ages 30 to 60 years. Population fluctuates about 20% during winter months when snowbirds are wanting to be in warmer weather. Communities have to plan for the increase in population during the winter months. The population in the Valrico community is predominantly white at 64.5%. The state average is 77.6%. There is a small mixture of Hispanic, Black, and Asian, which adds to the diversity. Even though Florida is becoming a more racially diverse state, this public school system is becoming more segregated. Enrollment trends of 2014 and 15 showed that there were more poor students. In schools with at least 50% non-white school body, low-income students represented 68% of the population. The school concentrates students not only by race, but also by poverty. Students facing challenges like poverty, lack of health care, or mental health services come to public schools every morning, increasing the segregation in Florida. The unemployment rate in Valrico is 4.5%, which is very low compared to the Florida average of 8.9%, which is very high. There are community employment opportunities for new businesses developments and employment with new construction in Valrico. Asians make the most annual income in Valrico. There's always room for improvement of decreasing the unemployment rate. Valrico is at its lowest in history. The recent job growth is positive, and Valrico jobs have recently increased by 1.62%. The unemployment rate in Valrico is 4.5%, which is very low compared to the Florida average of 8.9%, which is very high. There are community employment opportunities for new businesses developments and employment with new construction in Valrico. Asians make the most annual income in Valrico. There's always room for improvement of decreasing the unemployment rate. Valrico is at its lowest in history. Valrico mainly consists of middle and upper middle class income. There are about 10% that live below the poverty level and are receiving public assistance. There are services provided in the community to those that meet the income requirements. There is a low-income housing as seen in the photo on the slide. This apartment complex is located in the Valrico area. The WIC program is a federally funded nutrition program for women, infants, and children. There are also programs such as United Food Bank, Services for Plant Cities, Salvation Army, Hillsborough County Society of St. Vincent de Paul, Metropolitan Ministries, Food Stamp Program, and SunCat Program. They're all programs that provide free or low-cost medical care and dental care to those who qualified. Child care services offer free or low-cost child care, such as Head Start and BFF Kids, as seen in the photo in the Valrico community. Health disparities involve health services and status among certain vulnerable population groups. Examples of vulnerable population groups that are a health concern are the poor and homeless, persons with special needs, pregnant teenagers, migrant workers and immigrants, people who abuse addictive substances, persons who are at risk for communicable infectious diseases, previous incarceration, and genetics. In 2015, the Tampa Assessment Advisory Committee identified the health needs of the community through analysis of data collected from multiple sources. The results showed that 1 in 6 people do not have a regular medical provider, 1 in 10 do not have health insurance. The most risky behaviors are drug abuse, alcohol abuse, and poor eating habits. The top factors that affect quality of life was low income, safe neighborhoods, good jobs, healthy economy, good schools, and a good place to raise their children. The primary public health concerns were obesity, chronic diseases, smoking, mental health issues, substance abuse, availability of health care, shortage of primary care physicians and dentists, poverty, violent crime, cancer, ethnic, racial, and socioeconomic disparities.
Every personal interview I completed with residents of Valrico have had the same story. They love the area. They feel safe in their individual neighborhoods and homes. Parents with children in the local school, Valrico Elementary, are extremely happy with the way their children are being schooled. I spoke with a member of the Valrico Elementary School PTA, and she reported that there is a waiting list for them as a school of choice. As stated previously, all personal interviews with individuals have revealed a love for the community as a whole. During my drive through the area to gather information, several people were seen out running or walking. Children were also seen riding their bikes. I found a local church that offers judo lessons for a donation of $20 a month to the ministry. Announcements from the county are put up for public viewing near the affected areas. Some signs are like this one, pre-printed, but others are handwritten. This can be both effective and not effective. Drivers are forced to read the signs as they drive by, creating a road hazard. However, publicly displayed information reaches more people in the community than posting the information either online or in a printed newspaper. Valrico has the unfortunate circumstance of sharing its budget with the rest of the unincorporated Hillsborough County. These are the areas that are not considered to be Plant City, Temple Terrace. County Commissioner meetings are broadcasted both live stream on the internet and on local television stations. A quick and simple Google search for Hillsborough County Commissioner meetings brings up a page with minutes of past meetings, videos of past meetings, and a calendar about upcoming meetings. On the same page mentioned above, there is a list of the board's policies, including how to use any financial overage and how to disperse those funds properly.
The top 3 community objectives are 1. Access to health services, which improves access to comprehensive, quality health care services. It promotes and maintains the health of the community, prevents managing diseases, reduces unnecessary disability and premature death, and health equity for the community. Number 2, social determinants of health. This creates social and physical environments that promote good health for all. Health starts in our homes, schools, workplaces, neighborhoods, and communities. Eating well, staying active, not smoking, getting immunizations, screening tests, and seeing a doctor when needed influences our health. Number 3 is environmental health. Interactions with the environment affect quality of life, years of healthy life lived, and health disparities. The World Health Organization defines environment as it's related to health as all the physical, chemical, and biological factors external to a person and all the related behaviors.
Valrico has one sheriff substation located in the southmost part of the community. This leaves the rest of Valrico to be served by surrounding communities. Valrico does not have a homeless shelter within the community itself, forcing those with a need. Thank you for